Hi, Kurt MUNOZ here, physical therapist with Balance Physical Therapy, here to talk to you a little bit about the importance of early and often PT or mobilization to the knee after a replacement. So some of the challenges we've had with COVID has been the lack of medical providers, physical therapists during these times where we've had our shelter in place and some of the outbreaks that have come along with the pandemic. Some of the challenges, though, if you've had something like a joint replacement, like a knee replacement, this gentleman here has had 2 knee replacements, and both during the time of COVID. The first one on the left, he did have the opportunity to have some early physical therapy, not as much as he would have liked, whereas on the right, he had, unfortunately, no opportunity to have physical therapy after his surgery. So some of the things that we look for as physical therapists, especially early on, is your ability to bend your knee and straighten it all the way out. So we can see here, just from a quick glance, the right knee has a little harder time getting perfectly straight. So some of the risks that come with the inability to straighten the knee after a knee replacement is when we walk and we take a step on that, we want that to be straight, steady as we heel strike, so we have the support needed so that knee doesn't buckle and give on us. So one risk without having that early, often physical therapy is not getting this knee all the way straight, having some of that risk of buckling when we take our walks, going up and down stairs, things like that. So with physical therapy, our first goal is to get the knee moving through its range of motion. That's our first priority. Before we do really focus on strengthening, we want to make sure that it can bend, and our goal is roughly 135 degrees. Now, does that mean everyone's going to get 135 degrees? No. Does that mean you're going to have a bad outcome? No. But that's our goal. And then, of course, we want to get, as I just mentioned, the knee perfectly straight. Once we've started to accomplish that, usually over the course of the first month, 6 weeks, then we start to transition towards strength. But if we do not get that range of motion back early, we have the risk of scar tissue building, forming in the knee, and that can really make the process difficult, sometimes even requiring more surgical intervention needed down the road because we just didn't get the range of motion required for things like sitting in and out of a standard height chair that you might see in the waiting room of your doctor's office. So again, the point of this video is to talk about some of the pros and cons. So the pros is having someone make sure that the kneecap or the patella of your joint replacement is moving really well. Making sure that we can straighten the knee all the way out, have that important stability during our walking phase, and then making sure that knee can bend as much as possible so we can get in and out of a standard height chair that you might see in your doctor's office without any difficulty or pain. So my message to you is really consider being very consistent with your physical therapy after a joint replacement. Make sure you get your range of motion back. You can get that leg straight to have the stability in your knee required for good walking. Make sure you can get up and down out of chairs comfortably because you've gotten that range of motion back. So if you have any questions, want to talk more about knee replacements, check out our website at balancept.com or give us a call. Thank you.